Wendell Potter, he's the president of the Center for Health and Democracy, the president of Business Leaders for Healthcare Transformation, the founder of Tarbell, and the author of Deadly Spin and Nation on the Take, two brilliant books you need to read. Wendell Potter is his Wendellpotter is his Twitter handle, or business M4A or M4A_now. And Wendell, welcome back to the program. Tell me the story of Gill and Ron Tanner.
Thank you, Tom. I learned about Gill and Ron just by going to GoFundMe and typing in the term high deductible and then Cigna. And I saw a whole bunch of people who have Cigna health insurance.
Now, if I could interrupt you right there, you used to work for Cigna.
I did. I worked for Cigna for 15 years, and I left after a crisis of conscience, and partly because of what I knew was ultimately going to happen with people in high deductible plans. I left soon after Cigna and other big insurers began pushing as many of us as possible who have private insurance into high deductible plans. And I knew then that we would reach the point in which thousands, millions of Americans have insurance, but they're functionally uninsured because of these high deductibles. And those people include Gill and Ron, who had almost a storybook life until fairly recently. They got married fairly late in their lives. They bought an old condemned townhouse in Baltimore, fixed it up, made to such grandeur that even this old house featured it on their TV show. And they bought their dream house in the country. Just around the time after they did that, Gill was diagnosed with breast cancer. And even though they have health insurance, they have so many bills coming in because of her high deductibles that they had to turn to GoFundMe to beg for money to be able to help cover Gill's medical expenses and their living expenses.
Which is insane. I mean, that's the whole point of insurance, is that you don't have to worry. And millions of Americans have a false sense of security right now because they think if they get sick, they're protected, and they haven't read the fine print in their policies, and they don't know what's going on. How widespread are these high? First of all, let's just explain the term high deductible. What does it mean if you have a high deductible policy, and how do you find out if you do?
Well, chances are very good that you do, because the industry, as I noted, was determined to move every last one of us as quickly as possible out of our HMOs and PPOs, which were the managed care plans that were prevalent in the 90s and early 2000s, into similar plans, but plans that also make you pay quite a lot of money out of your own pockets before your coverage kicks in. And that includes you have to pay out of your own pocket often for medications that your doctor says you need, or to even go to the hospital or the doctor's office. So as a consequence, many people, like you said, they think they're adequately insured until they get sick, until they need to go to the drugstore to pick up their medications and find out that even with insurance, they have to pay hundreds, if not thousands of dollars right out of the gate to get the coverage that they need. And that's what Gill is facing. Their policy renews at the beginning of every July, and she has to spend $8,000 to $10,000 during those first several weeks just to cover her medications that she needs to stay alive. $8,000 to $10,000.
These being the high deductible policies. Are we seeing, by the way, if I could just go off topic just a little bit here, are we seeing the same kind of scam begin to be run with Medicare Advantage programs, yes. these privatized things that pretend that they're Medicare? This morning, Joe Namath was on TV again going, you need to get all the benefits you can from Medicare Part C. You're losing out. And I could just imagine all over America, there are people going, oh, Medicare Part C, it sounds like, Medicare Advantage, that sounds pretty good.
Exactly.
Is this happening with Medicare Advantage plans too, these high deductibles?
It absolutely is. People are being lured into these plans by Joe Namath and others, and who knows how much he's being paid. In fact, I need to write something about that to investigate that. Yeah, people don't realize, they never hear from Joe Namath what the downsides of these plans are. These are just exactly like private plans. They have all the bad aspects of a private plan. You have high deductibles, you have a limited network of healthcare providers, and you have to know that you're subjected to the possibility of prior authorization, which means that whatever your doctor recommends and prescribes for you, that your insurance company may say no. That's what prior authorization is all about. Your doctor has to get approval in advance before treating you, like he or she thinks you should be treated. They never, have you ever heard Joe Namath say that? I don't think so.
No.
But people are being lured into these plans. In fact, United Healthcare is the biggest player in Medicare Advantage, but so is Cigna, so is Aetna, so is Humana in particular. But they make money hand over fist. 71% of United's first quarter earnings or revenue came from Uncle Sam, largely because of their luring so many people into their Medicare Advantage plans. 100% actually of United's Medicare enrollment growth over the past 10 years, Tom, 100% has been in Medicare Advantage and Medicaid. They have actually lost 35,000 commercial members over the past 10 years.
Wow. How did an insurance company get involved in Medicaid?
Well, because the states fell victim to the industry's propaganda campaigns, saying that people like I used to be, or my counterparts, would go to state officials and say, "Look, if you contract with us, we being a private insurance company, we can save you money on your Medicaid program." And there are a lot of gullible folks in this country. A lot of them are in working for state governments. And they said, okay, we'll give it a shot. So what has happened is that the majority of Medicaid programs, which are administered at the state level, are now managed by big private insurance companies like Anthem Blue Cross, which is a very big player. A company you've probably never heard of called Centene manages a lot of states' Medicaid programs. So does United. They're making money by the bucket loads off of state governments. So our tax dollars are going into these health insurance companies in ways that most people don't know. We're supporting them. We are financing their profits through the Medicare program and the Medicaid program.
That's amazing. That's absolutely amazing. So, you're the president of the Center for Health and Democracy and Business Leaders for Healthcare Transformation, and you've got, a wonderful website over at tarbell.org, right? Who's doing what? I mean, are there any politicians out there who are fighting the good fight? Is anybody trying to push back on this? I know that these companies have mind-boggling amounts of money. I mean, we're talking billions and billions of dollars. Buying off a politician with $500,000 or $1 million, seems like chump change. Is there a strong pushback in the United States among politicians? And if so, where and who?
It's beginning, and I would say it's beginning, well, all modesty aside, I've been encouraging politicians to do something in particular about the overpayments to Medicare Advantage plans. And to her credit, Congresswoman Katie Porter last week, along with a number of other members of Congress in both the House and the Senate, sent a letter to the Center for Medicare and Medicaid Services asking for a review and reconsideration of CMS's planned rate increase or pay raise, if you will, for private insurance companies. CMS a few weeks ago said that they would be giving private health plans, an 8.5% raise during this year. So Congresswoman Porter, who is no fan of health insurance companies, took it on herself to begin drafting a letter and got several members of Congress fired up to join her. And they include on the Senate side, you've got Bernie Sanders and Elizabeth Warren, but also Cory Booker and some other members of Congress, of the Senate. And you've got on the House side, you've got Congresswoman Jayapal from Washington State, Debbie Dingell, Rosa DeLauro, who's chair of the Appropriations Committee, Jan Schakowsky, who is on the Energy and Commerce Committee. So you've got some people who've got some real clout, finally beginning to pay attention.
But it's going to take more than just writing letters. I mean, this is going to take legislation, ultimately. Yeah. Wendell Potter. So if people want, just very quickly, Wendell, if people want to learn more about this, they want to sign up, they want to become activists around health insurance policies, what do they do?
Well, reach out to me. certainly through Tarbell, through my website. Check us out at loopcoalition.org, which in particular is fighting against high deductibles. That's loopcoalition.org. You can sign up for more information there.
How do you spell that?
Loop, L-O-O-P, coalition. Loop stands for lower out-of-pockets. So it's our coalition that I formed with over 50 organizations, Thom, to push back against high deductibles. It's Loop now. And again, the website is loopcoalition.org.
Very good. Wendell Potter, one of the genuine good guys out there. Wendell, thank you so much for the great work that you're doing and for coming on our program today.